Hello, good morning. My name is Sony Joseph. Today we're going to talk about diabetes and macrovascular complication of diabetes. So before we go into detail of what macrovascular complications are, let's look at what diabetes actually is. Diabetes is a condition where the body is unable to process glucose for energy. Diabetes is a common condition. About 3.2 million people are diagnosed with this condition, and 850,000 people are already got this condition, but they don't know they got this condition. So this is called pre-diabetes. As we know, diabetes mainly two types: type 1 and type 2 diabetes. Regardless of which condition you are susceptible for getting diabetes complications. By and large, the diabetes complication can be divided into mainly two categories. Depends on where this complication can happen. If this complication happens on a minor, small blood vessels in your body, that's called microvascular complications. If this complication occur on a medium to large blood vessels, then it's called macrovascular complications. The examples of microvascular complications are neuropathy, retinopathy, and nephropathy, which affects kidney, eyes, and nerves respectively. So we're not going to talk about microvascular. We're going to talk about complications occur on a bigger blood vessels or macrovascular complications. So what happens in the macrovascular complications? In macrovascular complications, blood vessel become narrower and causing less blood to flow through, and area supply, that area can be damaged. So that's what pretty much happens in macrovascular complications. So the fundamental process for this macrovascular complication is called atherosclerosis. So in other words, the fat cells are sticking together and they are clinging on the blood vessels. So when that happens, the area in which the blood supply flow through will be diminished. So over the years, this can cause awful lot of damage to your system. Depends on where this macrovascular complication happens. We could divide that complication into three categories. One is called coronary artery diseases. Other one is peripheral vascular diseases, and third one is cerebrovascular diseases. So what is coronary artery diseases? It refers to disease happen in the blood vessels into your heart muscles. A complete blockage of an artery results in a myocardial infarction, or otherwise called heart attack. The symptoms of this are angina, pretty much everyone knows about it. Heart attack, the symptoms, also you can feel that chest pain, the pressure in your heart, cramping sensation or heavy feeling in the chest. Sometimes people feel shortness of breath. Sometimes can be extremely fatigued. Those are some of the symptoms of coronary artery diseases. The treatment of this include coronary artery bypass surgery or angioplasty. So these are the coronary artery diseases. So what happens in peripheral vascular diseases? In peripheral vascular diseases, blood supply to the legs and feet are affected. When people get this, they have feeling like cramps, weakness, or pain when they walk. So this is called a claudication. Sometimes a completely blocked artery will lead to severe pain in your legs. And sometimes when people feel that cold and pale when they touch. Treatment for peripheral vascular disease include surgery or repairing it, surgical. So the surgical means it's called angioplasty. So this is what happens on a peripheral vascular diseases. The third complication we already talked about, cerebrovascular diseases. So what happens in this condition? Cerebral means brain, so blood supply to your brain cells are affected. If it's a smaller blood vessels affected, sometimes it comes out as a transient ischemic attack. So it's a partial blockage of the blood supply to the brain. Sometimes bigger blood vessel can be affected, sometimes the complete blockage can happen. That times it's known as stroke. The symptoms of the strokes are lightheadedness, dizziness, loss of ability to speak, slurred speech, confusion, and inappropriate behavior. So these are some of the symptoms of cerebral vascular diseases. The immediate, if someone having this attack, obviously they need to go to hospital immediately. So let's we know about 3 complications can happen on a microvascular aspect of diabetes. So peripheral vascular diseases, cerebrovascular diseases, and coronary artery diseases. We know that about 4 to 6% of people with diabetes can have these complications compared to general population. So especially if you got diabetes, the possibility is that you can have hypertension as well as high cholesterol as part of this. So if you got these conditions along with the diabetes, so you need to be really, really careful about preventing these complications. Especially if you're a smoker, the chances are you have this complication can be even higher. So heart attack and stroke represent the major cause of death in UK, especially those people with a type 2 diabetes. So what can I do to minimize these complications or minimize the complication of macrovascular origin? The good news is that you can help yourself to minimize these complications, making sure that you follow good diet, make sure that you do the exercise on regular basis. Always make sure that keep your blood sugar on a near to normal level. If you're a smoker, stop smoking. Don't drink too much alcohol. All those things can contribute to controlling these complications. If you got a high blood pressure and if you're taking the medication for it, make sure that you do that on a regular basis. Always follow a healthy, good, balanced diet. Eat food that are high in fiber and low in fat. And last and foremost is to make sure that you follow the advice of diabetes healthcare team. By following all those things, you can reduce the complications of macrovascular complications of diabetes. Thank you for listening. Bye.